Okay, let's quickly go over colon cancer screening. This is really important in step 2 as well as step 3. The screening is different depending on if the patient is at average risk or at increased risk. When the patient is at average risk, this can be the general population, or you have a single first-degree relative who has had colon cancer or adenomatous polyps, but their age is more than or equal to 60 years old. These patients at average risk start screening at the age of 45. So your options for screening can be colonoscopy every 10 years. You can get a fecal occult blood test or a fecal immunochemical test every year. You can do a FIT DNA test every 1 to 3 years. This is a multi-target stool DNA test. You can also get a CT colonography every 5 years or a Flex Sig every 5 years or every 10 years combined with an annual FIT or the fecal immunochemistry test. Oftentimes you'll probably just pick colonoscopy every 10 years. Now, there are patients at increased risk. So these patients are people with a first-degree relative at the age of less than 60 with colon cancer or adenomatous polyps, and this also includes more than or equal to 2 first-degree relatives with colon cancer or adenomatous polyps at any age. For these patients, you want colonoscopy at age 40 or 10 years before the age of the cancer diagnosis in that relative that we're talking about, whichever one comes first. So for example, if my patient has a first-degree relative who got colon cancer at 49 years old, I would give this patient screening starting at 39 years old versus regularly starting colonoscopy at 40 years old. You repeat a colonoscopy every 3 to 5 years depending on the results.